You're watching TVC Breakfast. The world is at war against a common enemy, COVID-19, but emerging stronger after the pandemic is dependent on how this period is utilized. The impact of COVID-19 is already taking its toll on global economy, but instead of focusing on the negative, now is the time to make the most of a bad situation. Now is the time to put those ideas you have been nursing into motion to birth inventions, especially in the world of science and technology. How is Nigeria faring in this regard? Joining me to discuss this is lawyer and social development advocate Daniel Bwala. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Well, the world has gone through a depression, recession before now, and it has always, risen above for all of this, especially coming out with different innovation. At this point that we find ourselves, do you think that we are going to bounce back via innovation boom with the change that has come as a result of COVID-19?
Right. What COVID-19 has actually done in the world is to expose every country's competence, capacities, and capabilities along the various sectors of their economy. The first and foremost, which is the central attack by COVID-19, is the healthcare system. As you can see, all over the world, there is no nation that has appeared to have been ready before the COVID-19. However, some nations, because they have strengthened healthcare system, are able to react to the situation in good time, like South Korea did. China tried relatively. America is still grappling with it. And for Nigeria, it's another story altogether. Now, but the opportunities that COVID-19 has created is that it is opening up countries to realize that if there is ever going to be a future for every country, everything from that country has to be homegrown at the best. For example, you recall that as soon as the first case, the index case of COVID-19 was announced in Nigeria, Nigeria went into panic mode because one, we didn't have the PPE, personal protection equipment. Two, we didn't have the requisite isolation centers, not to talk of the healthcare facilities that would be installed at the isolation centers. Three, we didn't have enough doctors trained for that purpose. And then four, we didn't have the method of containment, which to a large extent is what we're still battling with. But the opportunities that COVID-19 would have opened Nigeria up to is that one, we must develop our research-based skills across the nations, across Nigeria, across the universities actually, because even in America, researches are conducted in universities. So the government will give a large chunk of money, either through grant or direct deposit from the government to those universities to begin to develop research in the area of vaccine, in the area of therapeutic drugs. Our research quest is sort of dead. I can't remember the last time we've talked about research in the university of any form of medicine or any form of science and technology. So the opportunity that this has opened us is, if we are serious as a country, is to look within and begin to make the necessary appropriations of the funds by the National Assembly for the purposes of taking care of situations that may arise in the future or the situations that we are faced with. As lawyer now, if before you go to court and you try to ask for any form of electronic filing, they will frown at you. If you tell the court that you have served the other party, since you couldn't locate his office, you served him by email, they are going to be frowning at you. But since this incident, the court was forced to adopt the virtual method of hearing of cases, that now simple application motions of some of these things are conducted from the comfort of your home via the use of technology such as Zoom, Instagram, and whatever. So we are going to have to look within and begin to explore opportunities. And thank God, even when you go to the advanced countries, blacks in those advanced countries, especially Nigerians, are actively involved in the innovations and in technology. Now the opportunity has opened up for us in the country, and let's see how we make the most of it.
But as it stands, from your point of view, seeing the opportunities that this has opened us up to, and with the structures we have on the ground, Can we make the best use of it? And are you confident that we'll make best use of this opportunity?
I am hopeful, but not confident. Hopeful in the sense that anything can happen in life. As long as you can breathe, you have hope. Even when you feel a state of despair and despondency, somebody can spark hope by his activities around you. But not confident in the sense that the policies of government so far have not been channeled to that purpose. Let's take, for example, when this thing started, I remember us going on air to talk about the need for us to patronize our local manufacturers of PPE, like the face mask, different types of face mask. I'm talking about face masks that can stand clinical tests. I'm not talking about people finding something, stitching it and covering their nose. And we have quite a number of people in the country who are into areas. For example, what stops you from turning the entire tailors in the country to production of face masks and then have the monitoring team to look at the standard by which you can then process the face mask, so that the money that people are bringing from the bank, from industry, from everything, are now devoted into this specificity. But instead, why I said I'm not confident, instead, we have allowed them at their own mercy and at their own risk to do the production and make the approach to individuals to buy from the market while we are busy making our orders from China, which in the first place is the beginning of the crisis. So that is not a government policy, in my view, that is tailored towards maximizing that local production. Then let's come to the issue of our doctors. I have traveled abroad. A couple of times when I was abroad, I go to see a doctor, a dentist. And I observed that all over the world, especially if you go to America and the UK, most of the doctors doing outstanding things are Africans, what we call the brain drain. They all move out of the country because the government policy in Nigeria does not encourage or promote that. Now, as soon as our doctors started, standing up to match up to the responsibility, even in the face of obvious absence of PPE, risking their lives in the front line, the government went ahead, in my view, to bring in people from China who they say at the time were coming to give us the technical assistance. When at that time World Health Organization recorded or pegged Nigeria as one of the highest countries that were managing the situation. So have we developed that confidence? Go to the various states government and see, apart from Lagos, and I think one or two states that have done incredibly well in managing isolation centers, in giving containment strategy, improving their testing capacities, day-to-day briefing of the people. Most of the states are rather basking in the euphoria of conspiracy theory that, in fact, COVID-19 is political. It is not real. And some of the isolation centers in the country are like jet places. That's why people run away from there. I have also advised the government that you can, for now, we do not have so much of people in isolation center. And we can stop people from escaping those centers by making a proposal that anybody who is isolated and is being managed at the isolation center is entitled to 5,000 every week.
All right, Daniel Bwala, we have to leave the conversation here. Thank you for speaking with us. You're watching TVC Breakfast. The world is at war against the common enemy, COVID-19, but emerging stronger after the pandemic is dependent on how this period is utilized. The impact of COVID-19 is already taking its toll on global economy, but instead of focusing on the negative, now is the time to make the most of a bad situation. Now is the time to put those ideas you have been nursing into motion to birth inventions, especially in the world of science and technology. How is Nigeria faring in this regard? Joining me to discuss this is lawyer and social development advocate Daniel Bwala. Good morning and thank you for joining us.
Thank you for having me.
I'd like for us to narrow this conversation to individuals now. How can one identify potentials or opportunities in a pandemic such as this, and what skills would that require?
Well, an individual, what do you look at as opportunities? You start looking at opportunities from your weakness. So what is the problem? The problem is that by virtue of this pandemic situation, we're all locked up in our respective homes. Even though the government has relaxed it, but there is minimal operations as far as working out of the comfort of your home. So one will try to look at, for example, technology. In the area of technology, what can we do to enhance our provision of services to the people and then to get a reward for that provision of services. The health workers will look at what can they do as frontline workers in ensuring that they contain the situation and then improve on the healthcare system. The government will look at what can the government do in the midst of this problem to still manage the containment and bolster the economy. The economy cannot function unless people go to work, unless that is, unless people are working. And so what is the measure the government is taking in maximizing the opportunity? For now, to the best of our knowledge, the government has relaxed and then decided that some critical sector of the economy can go back to work. Now, that is good, but whether it is maximizing the situation is what I cannot tell. But as an individual and as a lawyer, what I am doing right from when we had the lockdown is to ensure that we create the virtual meeting system where I talk with my lawyers on what we need to do to improve on where we are so we don't get clogged by the situation. And we've been able to substantially improve the provision of services by ensuring that we contact our client to let them know that our services are still open up to them. If they want to have meetings with us, they can have it through virtual hearing. If they have specific problem, we can tailor that solution to the problem. And of course, with respect to court, we then appear in court to a virtual hearing to move in application. If it is a criminal case for which trial is required, then you have to physically go to the court. And thankfully, the CJN and the CJ of the FCT have issued practice direction that is now releasing the practice of lawyers. And I'm sure that the generality of the masses will then look at how, if you're a market woman, for example, what can you do to improve on that? What can you do to maximize the problem? I've seen somewhere in my time where people are having mobile market moving into various gated communities. So instead of going to the market to be exposed to the risks of coronavirus, you then have a mobile market moving. And then you can then maximize the time and then buy what you can buy. I don't have the specificity of the exactly what can do, but the same way other nations have been confronted by, we need to think deep and see how we can improve on where we are. Because if we continue to remain the way we are in the next 5, 6, 7 months, I'm sure there will be no economy for us to be able to survive. The media, what are the media people doing? If it were in those days, I would be live in your studio responding to the question. But because of this situation, you felt that rather than exposing people to risks, you could still talk to us from our virtual homes. In other words, rather than that thing killing your activities as a media outfit, you maximize it by reaching a wider network of people. So in my view, this is what we need to really, really look into. And like I said earlier, when you interviewed me, the government has to improve research. We have to improve research to be able to contain this problem, because health experts are saying that in the summer, there is going to be another strain of this coronavirus. And these things are going to continue. Some people are alleging it's a bioterrorism. So this thing has come to stay. What can we do to affect it? We talked about the infectious control bill, which was sponsored by my friend, the speaker, which is a laudable project. We're now looking into how we can improve on the bill, because so much of criticism has been leveled on it. And we are of the view that it should not die, it should live, but then we can improve it. Some of the things we can do, once we make them into law, it will give us the legality and the legal backup in doing e-business, e-commerce, and e-transactions.
All right, Daniel Bwala, let's leave the conversation here now. Thank you so much for speaking with us.